What does colon cancer look like?
Oh no, oh no. Oh.
I kept dismissing the blood in my stool, thinking it was just hemorrhoids. By the time I finally saw a doctor, my colon cancer had already spread to my liver. These haunting words from Michael Reynolds, a 42-year-old father of 3 from Denver, echo the experience of thousands of Americans who discover their colon cancer too late. Last year alone, over 52,000 Americans died from colorectal cancer, making it the second leading cause of cancer deaths in the United States. But what's truly shocking is that 60% of these deaths could have been prevented through early detection and screening. Hi, I'm Dr. Mark, and today we're going to walk through Michael's journey to help you understand exactly what colon cancer looks like, from its earliest warning signs to its advanced stages. Michael's story isn't just about missed symptoms. It's about understanding what makes this disease so dangerous, and more importantly, how to catch it early. When Michael first noticed occasional blood in his stool 3 years ago, he was running his successful construction business and training for a marathon. Like many Americans, he thought he was too young and too healthy for cancer. He attributed his occasional constipation and diarrhea to his protein-heavy diet and intense training schedule. But these symptoms weren't just about his lifestyle choices. What Michael didn't know was that his body was already giving him classic warning signs. The alternating constipation and diarrhea, the dark blood mixed with stool, the unexplained fatigue after his usual 5-mile runs, these were all red flags. But here's where things get interesting. These symptoms can mimic several other conditions. Let's break down what else could have caused Michael's symptoms. Inflammatory bowel disease, or IBD, can cause similar bleeding and bowel changes. Irritable bowel syndrome, also known as IBS, often presents with alternating constipation and diarrhea. Celiac disease can cause fatigue and digestive issues. Diverticulitis can lead to bleeding and pain. Even something as simple as hemorrhoids can cause rectal bleeding. This overlap in symptoms often leads to delayed diagnosis, as happened in Michael's case. When Michael finally saw his doctor, after losing 15 pounds without trying, the examination revealed something concerning. His doctor ordered a colonoscopy, which showed a large tumor in his ascending colon. But why hadn't his annual physical caught this earlier? The answer lies in the limitations of routine blood work and physical exams. Standard blood tests don't always show early-stage colon cancer, and physical examinations can't detect tumors deep within the colon. The subsequent CT scan revealed that Michael's cancer was already at stage 3C, meaning it had spread to nearby lymph nodes. Looking back at his family history, doctors discovered that his grandfather had died from colon cancer at 65. This genetic connection, combined with his diet high in processed meats and low in fiber, had increased his risk significantly. Today, 2 years after his diagnosis, Michael is cancer-free, but his journey was challenging. He underwent surgery to remove part of his colon, followed by 6 months of chemotherapy. His survival came down to 3 key factors: his overall good health before cancer, the aggressive treatment plan his oncology team implemented, and his strong support system. For viewers watching this, remember this crucial point. Colon cancer is one of the most preventable and treatable cancers when caught early. Regular screening should begin at age 45 for most people. Earlier if you have family history or risk factors. Watch out for persistent changes in bowel habits, unexplained weight loss, and especially blood in stool, no matter your age. Michael's message to everyone watching is clear. Don't wait. Don't rationalize away the symptoms like I did. A simple screening could save your life. Remember, colon cancer doesn't always look like you'd expect. It can affect young, healthy individuals, and its early symptoms can be subtle. But understanding what to look for could make all the difference between an early, treatable diagnosis and a life-threatening situation.